Trigeminal neuralgia. Introduction. Trigeminal neuralgia, TN, is a chronic pain disorder affecting the trigeminal nerve, which is responsible for facial sensation. It is characterized by sudden, severe, electric shock-like pain in the face, often triggered by mild stimulation such as talking, eating, or touching the face. TN can significantly impact a patient's quality of life and requires effective management strategies for pain relief. Definitions. International Association for the Study of Pain, IASP. Trigeminal neuralgia is a sudden, usually unilateral, severe, brief, stabbing, and recurrent pain in the distribution of one or more branches of the trigeminal nerve. World Health Organization, WHO. A neurological condition affecting the trigeminal nerve, leading to intense episodic facial pain that can be debilitating. Risk factors. Neurovascular factors. Compression of the trigeminal nerve by a blood vessel, example superior cerebellar artery. Multiple sclerosis-related demyelination. Brainstem tumors affecting the trigeminal nerve. Lifestyle and environmental factors. Aging, more common in individuals over 50 years old. Stress and anxiety. Cold weather exposure. Etiology. Primary trigeminal neuralgia. This type occurs due to vascular compression of the trigeminal nerve, most commonly by the superior cerebellar artery. The pressure leads to the demyelination of nerve fibers, causing erratic pain signals and hypersensitivity. Secondary trigeminal neuralgia. This results from underlying conditions like multiple sclerosis, brain tumors, or facial trauma that affect the trigeminal nerve. These conditions disrupt normal nerve function, leading to chronic or atypical facial pain episodes. Types. Classical trigeminal neuralgia, TN1. This type presents with sudden, intense, and sharp pain episodes that resemble electric shocks. The pain is usually triggered by everyday activities such as talking, eating, or touching the face and lasts for a few seconds to minutes. Atypical trigeminal neuralgia, TN2. This form is characterized by a constant, dull, or burning pain that is less intense but more persistent. Unlike TN1, TN2 does not always have distinct pain-free intervals, making it more challenging to manage. Pathophysiology. Vascular compression of trigeminal nerve, superior cerebellar artery, veins. Down arrow. Demyelination of nerve fibers, damage to protective myelin sheath. Down arrow. Ectopic impulse generation, erratic nerve firing due to loss of insulation. Down arrow. Hyperexcitability of trigeminal nerve, increased pain signaling and sensitivity. Down arrow. Episodic or continuous pain attacks, triggered by normal stimuli such as touch, chewing, or speaking. Clinical manifestations. Sudden, intense, stabbing or electric shock-like facial pain. Pain episodes lasting from seconds to minutes. Unilateral facial pain, typically affecting the jaw, cheek, or forehead. Triggers include talking, chewing, brushing teeth, or cold wind exposure. Pain-free intervals between attacks in early stages. Progressive worsening of pain in severe cases. Diagnostic evaluation. History taking, identifying the onset, duration, and characteristics of pain is crucial to understanding triggers and differentiating from other facial pain conditions. Patients are asked about specific activities that provoke pain, such as chewing, touching the face, or exposure to cold air. Physical examination. A detailed neurological examination is performed to assess facial sensation, reflexes, and muscle function. This helps in ruling out other neuropathic disorders and determining the extent of trigeminal nerve involvement. Magnetic resonance imaging, MRI scans are used to detect possible nerve compression by blood vessels, tumors, or multiple sclerosis lesions. It helps in differentiating primary trigeminal neuralgia from secondary causes like brainstem tumors or demyelination disorders. Electrophysiological studies. These tests help evaluate nerve function and rule out other neuropathic conditions. They are particularly useful in distinguishing trigeminal neuralgia from conditions like peripheral neuropathy or postherpetic neuralgia. Medical management. Anticonvulsants, medications like carbamazepine and oxcarbazepine are the first-line treatment, working by stabilizing nerve activity and reducing pain episodes. These drugs help decrease abnormal electrical signals in the trigeminal nerve, preventing sudden pain attacks. Muscle relaxants. Baclofen, a muscle relaxant, is used to reduce nerve hyperactivity and ease pain associated with trigeminal neuralgia. It is often prescribed as an adjunct therapy when anticonvulsants alone do not provide adequate relief. Tricyclic antidepressants, amitriptyline and other tricyclic antidepressants help in managing chronic neuropathic pain by altering pain perception. These medications work by increasing serotonin and norepinephrine levels, which play a role in pain modulation. Botulinum toxin injections. Botox injections can help in refractory cases by reducing nerve excitability and blocking pain transmission. The effects typically last for a few months, providing temporary but significant relief from pain episodes. Surgical management. Microvascular decompression, MVD. This surgical procedure relieves nerve compression by repositioning or removing offending blood vessels that press against the trigeminal nerve. It is the most effective long-term treatment, offering significant pain relief while preserving nerve function. Radiofrequency rhizotomy, a minimally invasive procedure that uses heat to damage selected nerve fibers, reducing pain transmission. It is commonly performed for patients who are not candidates for major surgery and provides quick relief, though numbness may occur. Gamma knife radiosurgery, a non-invasive technique that delivers focused radiation to disrupt nerve pain signals without the need for incisions. It is useful for patients who cannot undergo open surgery, though results may take weeks to manifest. Glycerol injection, a chemical ablation procedure where glycerol is injected into the trigeminal nerve branches to relieve pain by damaging the affected nerve fibers. This method is less invasive and provides moderate pain relief, but its effects may be temporary. Balloon compression, a procedure where a small balloon is inserted and inflated at the trigeminal nerve root to compress and damage pain-conducting fibers. This is a short-term solution that provides relief for months to years before the pain may return. Cyberknife radiosurgery, a highly precise robotic radiation therapy that targets the trigeminal nerve to interrupt pain signals. This is similar to gamma knife but offers flexibility in treatment angles, making it a preferred option in some cases. Dietary management. Soft diet to avoid triggering pain while chewing. Warm, easily chewable foods to reduce facial strain. Avoidance of spicy or extremely cold foods that can trigger pain episodes. Hydration to maintain overall nerve function. Nursing management. Nursing diagnosis, acute pain related to nerve compression and hyperexcitability of the trigeminal nerve. Interventions. Assess pain characteristics, intensity, and triggers using a pain scale. Administer prescribed anticonvulsants, example carbamazepine, and analgesics to manage pain. Encourage relaxation techniques such as deep breathing and meditation to reduce stress-induced flare UPS. Advise the patient to avoid known triggers such as cold air, chewing hard foods, or excessive facial movements. Nursing diagnosis, imbalanced nutrition, less than body requirements related to pain-induced difficulty in chewing and swallowing. Interventions. Encourage a soft diet with warm, easily chewable foods to minimize pain while eating. Provide nutritional supplements if the patient is unable to meet caloric needs. Monitor weight changes and hydration levels to ensure adequate nutritional intake. Nursing diagnosis, anxiety related to chronic pain episodes and fear of pain recurrence. Interventions. Offer psychological support and reassurance to alleviate fear and distress. Educate the patient about the condition, treatment options, and coping strategies. Encourage participation in relaxation therapy or counseling if anxiety becomes overwhelming. Nursing diagnosis, risk for social isolation related to fear of pain attacks in public and avoidance of social interactions. Interventions. Encourage social engagement while providing strategies to manage pain in public settings. Connect the patient with support groups for individuals experiencing chronic pain. Educate family members to provide emotional and social support. Nursing diagnosis, deficient knowledge related to lack of information about disease process and self-care management. Interventions. Educate the patient on the pathophysiology, triggers, and management of trigeminal neuralgia. Demonstrate proper medication administration and stress the importance of adherence. Provide written educational materials for home reference and follow-up care. Prevention. Stress management techniques such as relaxation exercises and meditation. Avoidance of known triggers, cold exposure, excessive talking, chewing hard foods. Regular medical check-ups for early diagnosis and management. Complications. Chronic pain and reduced quality of life. Malnutrition due to difficulty in eating. Anxiety and depression due to constant pain episodes. Resistance to medications, requiring surgical interventions. Conclusion. Trigeminal neuralgia is a severe, chronic pain disorder that affects facial nerves, leading to intense, debilitating pain. Early diagnosis and appropriate management, including medications, surgical options, and lifestyle modifications, can help improve the quality of life for affected individuals. A multidisciplinary approach involving neurologists, pain specialists, and supportive nursing care is crucial for effective symptom control and patient well-being.